If you were going to go through all of the effort and spend the money to have an expensive medical procedure, wouldn't it make sense to do everything in your power to help guarantee a good result? For me, it did, which is why when I had stem cell therapy in my lower back earlier this year, I created a comprehensive rehab routine to help ensure the best possible result for my treatment. In this video, I'm taking you through that routine one step at a time. Let's get into this. For the sake of simplicity, I divided the routine up into 5 components: lifestyle modification, stretching and strengthening, traction, supplementation, and tech. The main lifestyle factor that I focused in on after treatment was how to reduce the strain associated with sitting. I'd read research that prolonged sitting without position change for as little as 4 hours could significantly reduce disc height in the lumbar spine. And I was also familiar with research demonstrating that sitting without a position change for as little as 20 minutes was enough to create physical changes in the lumbar spine associated with instability. And the last thing in the world that I wanted to do was contribute to the disc bulges that I already had going on. But at the same time, I needed to be able to get some work done. So I set out to find a plan that would allow me to do both. In this study from 2014, published in the journal Physical Medicine and Rehabilitation, researchers examined the effect that prolonged sitting had on the lumbar spinal discs. Essentially, they took a bunch of people with sedentary jobs and they gave them an MRI before they went to work. They then had them go to work and perform their desk jobs for 4 hours, and then they came back for a follow-up MRI, which allowed researchers to measure before and after disc heights in the lumbar spine. And then on day 2, they did something similar, but with a little twist. They still had an MRI before performing their sedentary desk jobs. They still went to work as usual, but every 15 minutes, they were instructed to get up out of their chairs and perform a 20-second stretching routine before going back to work. At the end of 4 hours, they had a follow-up MRI. What these researchers found was that on day 1, when they stayed in their seats for 4 hours continuously, they lost as much as 2.5% of their disc height in that short time. Whereas on day 2, when they were getting up every 15 minutes and performing that short amount of stretching, there was almost no change in disc height at the end of the day. And if you're wondering what that 20-second routine consisted of, it was this. They would stand up from their chairs and then they would forward bend for 5 seconds. And then they would backward bend for 5 seconds. And then they would bend to the right for 5 seconds and bend to the left for 5 seconds. And while I really like the idea of a super short, hyper-focused routine to help break up prolonged sitting and decrease wear and tear on the discs, there were a few things about this particular routine that just didn't make sense to me. So I came up with my own. What didn't make sense to me about the routine that these researchers were using is that they would have people get up after sitting in a flexion-based position and immediately have them go into a forward bend, creating even more flexion in the lumbar spine. So I modified my routine. And what I do is I get up out of my chair and I immediately go into spinal extension for 5 seconds. Just moving through the range of motion that's comfortable for me. I then use a bench and I step up on it with my right foot and lean into that stretch, opening up the hips. After 5 seconds, I switch over to the opposite side and I open that hip. Just going through the range of motion that feels good. I come up on the ball of the foot, on the down foot here, to really elongate the hip flexors. And then just like the routine that they were using, I finish with 5 seconds of right lateral flexion and 5 seconds of left lateral flexion. Just a slight variation on their routine, but it makes a lot more sense for counteracting what happens to the body in a sitting position. Category number 2 is stretching and strengthening, and there are 3 main things that I did here to help decrease strain on my spine and set the stage for maximum repair in those spinal discs. Number 1, I committed myself to opening my hips every single day. One of the best things that you can do to decrease stress and strain on your lower back is to maintain strong, flexible hips that can effortlessly move through a full range of motion and absorb a lot of force before it ever makes its way to your spine. Number 2, I removed exercises like front squats, back squats, hack squats, deadlifts, and leg presses from my exercise routine, and I replaced them with single leg exercises like lunges, split squats, single leg deadlifts, and sled pulling, exercises that can build a ton of strength and provide a phenomenal workout without all the compressive load on your spinal discs. And as an additional benefit, these exercises also move the hips through a much greater range of motion. Number 3, I added dynamic stabilization exercises for my spine in all 3 planes of motion. And for the dynamic stability work, I was using one of my favorite tools, the body blade, which allowed me to perform 15 to 20 seconds of work and then immediately rotate into a different plane of motion without changing equipment. So I would start off in the sagittal plane with an overhand grip on the blade, out in front of you, slight bend in the elbow, squat stance, up and down motion with the blade, working flexion, extension of the spine. After 15 to 20 seconds, put the blade into one hand along the side of your body. Narrow stance on this one, working side to side stabilization in the coronal or the frontal plane. You're going to feel all the side of your body activate. Switch over to the opposite side, repeat for 15 to 20 seconds, and then we're going to finish with a movement that I've demonstrated before on this channel, which is rotation, anti-rotation, working in the transverse plane. So grasp the blade dead center, interlace the fingers, squat stance, very slight bend in the knees. (15 to 20 seconds there, rotating through each of those 3 planes of motion with very little rest in between provides an awesome workout, and it can give a great boost to spinal stability. Now, I sort of glazed over the hip mobility component there, and that's because for the sake of efficiency, what I really tried to do with this routine was bake as much hip mobility as I possibly could directly into my strength training, leaving as little additional work for me to do as possible, and for the most part, I was able to do that. But there were still a few hip movements that I chose to focus on a daily basis: hip internal and external rotation and deep end range flexion. For hip internal and external rotation, I was using seated hip flips. This motion is a fantastic way to glide the head of the femur inside of the socket. I would perform 20 to 30 repetitions a day of this movement. For anyone unable to perform the seated version, no problem. Simply lie flat on your back, take a wide stance, touch the inside of one knee down to the floor and the opposite knee, the outside will touch the floor, opposite direction, and repeat. Back and forth. Internal and external rotation at the hips. For end range hip flexion, I was using a deep squat, and I would spend about 1 to 2 minutes a day in this position. Notice how I'm pushing my knees open, which helps me to get a little bit of hip abduction at the exact same time. Also notice how I maintain the neutral curve in my spine in the bottom position with my heels in contact with the floor. This helps to keep stress off of my spine and keeps all the tension and stretch targeted directly on my hips. And for those of you who are unable to perform the deep squat, you can still mobilize the hip into end range flexion just by lying on your back and pulling the knee up to the shoulder. You can get a little bit of hip abduction by pulling the knee away from the midline of your body, more out towards the elbow. Hold for 60 seconds, switch over to the opposite side, and repeat. If you have knee trouble, simply grab behind the knee and perform the exact same stretch. Category number 3 is spinal traction, and I went into this rehab routine thinking that I'd use a traction device to increase spinal extension and create some negative pressure inside of the spinal discs to help reduce and suck back in those disc bulges, which is a technique that I've successfully used with hundreds of patients over the years. However, for me, it became apparent very early on that this technique was not going to be helpful. You see, I have a genetic tendency towards hypermobility. You see how I can easily touch my thumb to my wrist like that? Well, that type of flexibility is present in the joints throughout my body, including my spine. And so when I began tractioning my lumbar spine and stretching those tissues for an extended period of time, it didn't take very long for it to start creating some instability and feelings of looseness and discomfort in my back. And so I discontinued all spinal traction within the first 2 weeks of this rehab routine. However, I would point out here that for anyone who's on the opposite end of the flexibility spectrum, that is, anyone who experiences a significant amount of movement restriction, stiffness, or rigidity in their spine, and particularly anyone who's lost the normal lordotic curve in their lower back, spinal traction can be an incredibly valuable tool. Category number 4 is nutrition and supplementation, and so I dove into the scientific literature to see if there were any specific nutrients that had been directly tied to degeneration of the spinal discs, and here's what I found. First, let's take a look at this article that was published in the journal Signal Transduction and Targeted Therapy in 2017. These authors did an extensive review of the kinds of changes that take place inside of spinal discs in response to aging, and they point out in this paper that chondroitin sulfates are one of the most important and abundant components inside of the spinal discs. And because the molecules of chondroitin sulfate have multiple sites with negative charges, it allows them to retain water like nobody's business. They're amazing at keeping tissue hydrated. The chondroitin sulfates also interact with growth factors and cytokines, so they have a super important role in tissue development, remodeling, and combating pathology. The authors go on to state that the depletion of chondroitin sulfates within the spinal discs during the degenerative process results in a decrease in tissue hydration, a loss of fluid movement, cell apoptosis, that's cellular death within the spinal disc itself, and ultimately the loss of disc function. So you can see here that when the amount of chondroitin sulfate in our tissues begins decreasing, it can spell big problems for the health of our tissues, especially the spinal discs, and our ability to move and function long term. Which is why supplementing with 1,200 milligrams of chondroitin sulfate every single day was a no-brainer throughout this rehab process. There's one other paper that I have to share with you guys because this was super interesting. Also published in 2017, this group of researchers set out to discover the underlying cause of degenerative disc disease, and they knew a few things going into this study from previous research that had been done. First, they knew that the degenerative process starts off in the center of the disc in what's called the nucleus pulposus. So spinal discs have two main components. There's the annulus fibrosus, which is the ligamentous outer wrapping of the spinal disc, and then there's the gelatinous core, that's the nucleus pulposus, and that's where degeneration starts. Number two, they knew that one of the main structural components of the nucleus pulposus, one of the things that's most important for maintaining the health of that tissue, is type 2 collagen. And so they derived this method for analyzing the status of the type 2 collagen inside the nucleus pulposus of spinal discs. And they found that in people with degenerative disc disease, the type 2 collagen in their nucleus pulposus was downregulated in a major way compared to people who didn't have degeneration of their spinal discs. Then they took it one step further. In a tightly controlled laboratory setting, these researchers used a pro-inflammatory cytokine specifically to cause the degeneration of extracted human nucleus pulposus cells so that they could watch and see what happened during the degenerative process at the cellular level. What they found was the addition of those pro-inflammatory cytokines caused an immediate upregulation of catabolic markers in the cells, markers of destruction. And what they were looking at here specifically was the activation of MMP enzymes, which are responsible for the degradation of things like cartilage and connective tissue in the body. At the same time, they found that it downregulated anabolic markers for things like aggrecan and collagen type 2. Now, while this destructive process was going on, the researchers introduced additional type 2 collagen back into these nucleus pulposus cells, and they found that it prevented any further metabolic destruction from taking place. They also found that the addition of that type 2 collagen dramatically reduced the apoptotic rate, the rate of cell death, and the levels of destroyed proteins in those cells. So it was protecting the cells. The conclusion from this study was that collagen type 2 exhibits protective effects in suppressing nucleus pulposus cell degeneration through its anti-catabolic, pro-anabolic, and anti-apoptotic effects, suggesting that it may be a promising therapeutic agent for the prevention and treatment of degenerative disc disease. Now, if you've been watching this channel for any length of time, you know that I'm constantly singing the praises of undenatured type 2 collagen for its many health benefits, but this study shows exactly why it's so important that anyone currently dealing with a degenerative disc problem and anyone looking to avoid disc degeneration in the future should be going out of their way to take in a sufficient amount of high-quality type 2 collagen every single day. Category number 5 is technology, and what I really wanted to know here was, with everything that I'm already doing, is there anything else out there that I haven't looked at yet that can help me to go above and beyond, to put the icing on the cake and help ensure the best possible results for the money that I've spent? And to answer that question, I want to direct your attention to this 2021 paper titled Enhancing the Therapeutic Potential of Mesenchymal Stem Cells with LED. These researchers conducted an exhaustive literature review of seemingly every study ever done on the subject of light-emitting diodes and their effect on mesenchymal stem cells. Now, there were 10 different articles that ended up meeting the inclusion criteria for this study. And what they discovered after poring over all of this data was evidence to suggest that photobiomodulation from red LEDs in particular can be an effective approach for boosting mesenchymal stem cell therapy. What does that mean? Well, the overall conclusion was that compared to non-irradiated mesenchymal stem cells, or MSCs, MSCs that had been exposed to LED have shown enhanced viability, proliferation, differentiation, cell metabolism, and the secretion of angiogenic factors. Translation: factors that are involved in the growth of brand new blood vessels and increased circulation in the body. Two things that are incredibly helpful when it comes to repairing damaged tissue or creating brand new tissue. And that's why I committed myself almost immediately following my stem cell therapy to 15 minutes every single day of red light therapy directly to the area that I had treated. Now, a few helpful tips for maximizing the results of red light therapy are: number one, expose the skin of the area that you're treating directly to your light source. Number two, position the light source 6 to 12 inches away from the area that you're treating. And number three, use the highest power light source that you can afford to minimize treatment times and maximize your results. A few more things that I should mention here with regard to lifestyle factors. When you're optimizing for tissue repair and regeneration, it's absolutely essential that you're getting adequate amounts of high-quality sleep every single night. Also, the importance of regular bouts of movement throughout the day cannot be overstated. It's been demonstrated in the scientific literature that regular bouts of movement not only increase nutrient delivery to the tissues in and around your joints, but they actually suppress the enzymes that are responsible for tissue degradation and cartilage destruction. And with regard to nutrition and supplementation, there's so much more that we could talk about. But if you're dealing with a situation where you've had a significant amount of destruction or degeneration to your joint tissues, that's cartilage, labrum, meniscus, tendon, ligament, you should absolutely be supplementing with type 1 and 3 hydrolyzed collagen peptides in a therapeutic dose that's 10 to 15 grams a day, every single day. And you should also seriously consider two substances, glucosamine sulfate and Apreflex, both of which have been shown to significantly downregulate the activities of enzymes that are responsible for joint tissue destruction and degeneration. And two honorable mentions that you should not forget about are MSM and French maritime pine bark extract, which have both been shown to significantly reduce pain levels and enhance functionality for joint-related problems. Please bear in mind that everything that we just went over is my personal rehabilitation process, based on the specific issues that I was dealing with and the condition that I was in going into my stem cell treatment. Some of these things may be helpful and appropriate for you, and others may not, and that's fine. Just take what's useful for you and throw out the rest. I'll put links for the resources that I talked about in this video in the description down below. If you got value and enjoyed this video, hit that thumbs up button and subscribe to the channel, and I'll see you next time.